Hello everyone and welcome. In this short training, we'll review how to handle situations when someone presents a power of attorney to request a patient's medical records as medical support assistants. It's our job to protect patient privacy while ensuring that legal representatives are treated respectfully and correctly. So, what is a power of attorney? Often called a POA. It's a legal document signed by a person known as the principal. It gives another person, called the agent or attorney, in fact, the authority to act on their behalf. But here's the key thing. Not every power of attorney allows access to medical information. It all depends on the specific wording in the document. For example, in Florida, what many people in other states call a medical power of attorney is legally known as a designation of healthcare surrogate. When you're reviewing a POA, your main question should always be, does this document explicitly include healthcare or medical authority? Now let's talk about what the document needs to say. You should be looking for specific phrases, like the agent has authority to make healthcare decisions, or the agent may access medical records, or even this power of attorney includes medical and mental health information. If you see words like these, the agent can request or receive the patient's records. However, if the document only talks about financial or property matters, it does not authorize access to medical information. Also, you have to make sure the document is signed and dated by the principal, that it's still active, meaning it has not been revoked or expired on, that the agent provides a valid photo ID. So, what do you do when someone brings a power of attorney to your desk or clinic window? First, ask to see the original or a certified copy of the document. Then verify their identity with a government-issued photo ID. Next, carefully read the section on the powers that are granted to the agent. If it clearly includes healthcare decisions, you can proceed with your standard release procedures. If it doesn't, or if you're unsure, pause the process. Refer the request to the privacy officer or the Release of Information Office for a final review. The person named in a power of attorney is called the agent or attorney in fact. They can only access medical records if the POA specifically includes healthcare powers. Always check for signatures, dates, and active status. And remember, when in doubt, it's always best to ask your privacy or ROI team for guidance. Thank you for watching.